Good evening to one and all. Before we begin, let me introduce myself briefly. I am Ms. Shobia Dalmik, moderator of this series. First of all, I thank our God Almighty for His country's blessings, and I would like to thank our management, board of directors, viewers, and technical people for giving a strong support to release this international webinar series 5. I am very much glad to share that we got more than 10,000 views and likes for the previous webinar. With the support and inspiration, we would like to present our fifth webinar series, that is Nurses with Science and Solidarity to Overcome the Pandemic. We all know that nurses are the backbone of healthcare. Nurses' roles are now more important than ever. They are the ones doing all works. Nurses in every roles are impacted. They are innovating and leading in the midst of the crisis. Every day, nurses and healthcare workers are putting their lives at risk to fight this pandemic situation, and it is essential that all countries and organizations work together to protect healthcare workers and save patients' lives. Our concern is for frontline nurses to be properly supported with the necessary personal protective life-saving equipments, adequate testing, physical and mental health assistance, and international solidarity is essential so that they can care for themselves and their patients well. So, to overcome this pandemic situation, here we have a distinguished personality, Dr. Rajinikanth Maruthu, Clinical Nurse Manager from Bloomfield Mental Health Services, Dublin, Ireland. He will be presenting the topic on nurses with science and solidarity to international webinar series to overcome the pandemic. Next, I hand over the session to Dr. Johnsy Helena, Principal of Sree Abirami College of Nursing, who is the convener for this session to introduce the topic and speaker.
Good evening, everyone. Greetings from Sree Abirami College of Nursing. On behalf of Sree Abirami College of Nursing, I welcome all the participants to join us for this session, and I invite all the faculty members and special regards to our chief guest for this day. I take privilege to introduce a guest of this day, Dr. Rajinikanth Maruthu. He is a clinical nurse manager in Dublin Southeast Mental Health Services from 2014 till date. He's completed his PhD in psychology in Golden State University, USA in 2008. His professional summary, let me explain briefly to you all. Over 14 years of professional nursing experience in guiding patients on their journey to mental wellness. He is assisted nurse practice development team as a student allocation liaison officer. He's managed a day center service with the aim of providing social support for individuals who have chronic and enduring mental health presentations and to support their rehabilitations, social inclusions, and recovery. He authored 7 books titles ranging from the target audience of students to health professionals. He's been resource person and active participant in various international research and educational conferences. He published numerous articles on mental health nursing in nursing journals. He's been external evaluator of doctoral thesis in nursing for 2 Indian universities. He developed a village adoption program in East Point College of Nursing, Bangalore, and received appreciations from many political personalities. So many qualities he has got. So now I'm happy to welcome Dr. Rajinikanth Maruthu for this session. Sir, I'm handing over the session to you, please.
Thank you, madam. Let me take the PowerPoint here. Good morning to everybody. Good morning here, and of course, good afternoon to all of you. So my topic is it audible, madam? Am I audible to everybody?
Yes, sir.
Yes, sir. Yes, sir.
Okay.
Go ahead.
So the topic which I have chosen, of course, which people wanted me to talk on is nurses with the science and solidarity to overcome the pandemic. Because past nearly 5 months, we have been talking about uh, COVID-19, and different names we have given. So this is really a high time that we are always speaking about COVID-19, a pandemic situation. And of course, everyone is aware how much the whole world is suffering due to this particular invisible virus. So here I just wanted to, I chose this topic because mainly we need to unite together, because we nurses have to support each other. So how the science and solidarity is helping will be helpful to our nursing community. So it's not only an individual nurse or individual community. It's all about the world. Nurse, in the sense, it's a unique term all over the world. So I'm talking about every individual nurse's well-being, individual nurses support, how we can support each other. So pandemic 2020. So the occurrence of an outbreak, this was announced, COVID-19 was announced as a pandemic state on 11th of March 2020. So since then we all have undergone a lot of different phases, lockdown, and then in the hospital we talk about wearing masks, PPE, and social distancing, hand washing techniques. And some people said it's a airborne disease. Some people said it is. So it is still puzzling. It is still puzzling, and there are a lot of progression also is happening. There are a lot of stigma, a lot of myth, a lot of a lot of different kind of social values, different kind of social ideations are spreading all around. So it is really a difficult situation, because in last 100 years of time we have never come across such a terrible condition. Because apart from the direct influence, or apart from the viral, the effect of the virus, the implication of the virus, more than implication of the virus, the people's livelihood is affected. So we are going to have a lot of a severe problem in 2021, comparing to 2020, because post-COVID state will be worse than the COVID period. So I just downloaded this only last night, maybe early morning, 1 o'clock in Indian time. For me, it was around 8:30 in the evening. So it is very latest one. It is the latest one, Worldometer. We all know about, because when I go to the office and I start searching Worldometer, and previously everyone must have looked into it per day, at least millions of time people look into, million views go into Worldometer within 12 hours of time. So I also looked into it. So at the time of March 30th, we could see India was around 18th place or 24th place or something like that. And it was slowly progressing upwards. So now India is in third place, and the total cases are 29 lakhs and something total cases, and 981 new deaths have happened. That means in 24 hours, 981 new deaths have happened. So that is what big problem here. So death rate is increasing in India. So this is due to a lot of lack of healthcare facilities and lack of the ventilators, and then again imbalanced healthcare provision. That means poor people do not get a proper healthcare services, and rich people get everything because they have money. So that's a reason. And then coming to the fact Ireland. So as you know, I'm working in Ireland. Currently, I'm working as a clinical nurse manager, night manager in Bloomfield Mental Health Services. So my role is mainly to support the nurses and support the nursing team and patient care. I mean, look into patient care services, patient care during the night time. So Ireland was in 18 or 22 when the COVID, I mean, when we started, like in March, end of March, it was in 22nd place. So slowly they stepped down. So they came down to 67th place. So which is a good achievement. But now in last 2 weeks of time, because we had a Saturday, Sunday, Monday holiday on 1st of August. So that since then the numbers are increasing now again. So the reason is that 3 days holidays, people were very liberal and they were going around, and so after that holiday, number of cases started increasing again. So that's significant here. So new deaths, one within 24 hours, one case has happened. But total deaths is 1,776. So comparing to India's death, so the people give more insight into it because the population is only 40 million in Ireland. So they tightened the healthcare provision and they tighten all healthcare sector activities in terms of providing PPEs, then training, and then monitoring. So monitoring the services, whether it is private or public sector, they continuously monitor and support. So it's not only monitoring is not only fault finding to support them. So they won't consider whether it is private or public, but they support every system. So what is the nurses' experience of this pandemic? What happens because of the pandemic? What happened and how my colleagues realized, how my colleagues explained to me, or what they were talking to me. So during my night rounds, I speak to the nurses and they come out with these kind of ideas. So one of the nurses has told me that I have to treat many patients who are not in my specialty, although the country has realized, country has released 6 editions of diagnosis and treatment guidelines. There is still no effective antiviral medicine. It is an unknown disease and everyone feels powerless. So this is what she felt like. She was feeling it is somewhere, it is going nowhere. So there is no light seen, so where we are going to, this is the real challenge. For any other diseases, they know what are the causes, they know how to prevent, they know what are the medications, but whereas for this invisible virus, it was really challenging. So they cannot move freely. So whereas the social distancing happened previously, the nurses used to support each other by having pat on the shoulder or handshaking and all this thing. But now this virus has created a space between each other. So the gap between each other. So, and moreover, everyone started feeling powerless, hopeless. So are we having tomorrow, or what's going to happen? It may happen to me. So if I work today and it might, I have my child. So if I go home, I'm going to spread the virus to others. So these kind of challenges, so they felt powerless. Another nurse felt I was very tired. I had to lie in bed for a whole day to recover from the fatigue after work. So the fatigue is the heavy work made everyone felt fatigue. and moreover, they felt really non-supportive or unsupportive. So that's really awesome, because people who are listening to this are mostly academic people, but people really who work in the clinical area, they know how tiresome it is. And I myself felt a really difficult time. I myself felt that was a difficult time when I was working in during the COVID period, because a lot of isolation, we needed to wear PPEs and a lot of other challenges. Let me discuss about the challenges what I faced in our next slide. And one of the other nurses felt it is an experience I would compare to a world war. And of course, I also felt like that. So I felt like, I mean, after 12 hours of shift, I used to feel that I was like a soldier. I was really helping. So of course, we are frontline people who are fighting against. There are, I mean, of course, multidisciplinary team people are there, like doctors and psychologists and all other people. So they all excused and they all kept distance. For example, one of the doctors was saying, "No, I cannot see the patient because the COVID is in the ward, in this ward." So what he did was, I can see the patient only through video call, right? So they have excuse and they protected themselves. So I'm not blaming them, because they need to see a lot of patients. So they started treating patients via video conferencing and with only the symptom assessments, symptom hearing the symptoms through nurses or the other team members. But it's only the care assistants and nurses. They are the close the frontline people. They cannot excuse. I could not say that, no, I'm not going into the ward. I had to go into the ward. I had to face the patients, the service users. I had to provide the service to the service providers, because I have to save them. I have to provide I have to provide what they want. So this is stressors and challenges. So as I'm focusing only on the nurse's perspective. So forget about all the patient perspective and everything. Today, our main focus is only on the nurse's perspective. So stressors and challenges. So workforce. The main first thing is workforce. First of all, the nursing workforce in the world is reducing because of various reasons. Because people feel that nursing is no more supporting their livelihood, and because other area people, they can get a promotion, they can get more money, and they can invest in different things. But nursing workforce, nurses have to rely upon only their only on their increments, or maybe waiting long time to get the promotion. And then again, it's survival of the fittest. Like each promotional grade is offered only to 1 in hundreds or 1 in 1,000, you know. And the increment for each grade is also not that great. So workforce is decreasing. We are opening lots of nursing colleges, but number of admissions are shrinking. So the workforce is really challenging. And what happened here during the COVID period, so I think it was around the beginning of or middle of March, when people said about COVID and everything, and we were watching everything on the TV. The Chinese people were wearing PPEs like an army. So we were commenting on it. Oh, this China, they are really they were really suffering and everything. But at the end, when we hear that it's coming to our own country, it's coming to Ireland. It came to Ireland, so people started precautions. So we have a health service executive, like in India, we say health department. So we call it as a health service executive. In here, we call it as a HSE. So the HSE developed a policy. Immediately, they introduced a policy for all the hospitals, all the healthcare sectors, that we needed to follow some protocol. So when we hear that, I was on duty, and we created a space for like isolation unit. If anybody is getting a fever symptom, a diarrhea symptom, immediately we have to isolate them. So this is what the protocol the only protocol we developed. And I was just going on rounds, and one of our Indian nurses who was working there, and she kept herself very much covered with the mask, and having hand sanitizers, and she was cleaning all around, and she was so shivering, and she said, "Oh, I have my son. Son is around 5 years old or something. So I'm afraid that if I go home, I may be spreading the virus or something." So eventually she got it anyway. So after all these precautions, she got the COVID. She was one of the first nurses who got the COVID in our service. Anyway, but she recovered. Thank God, she recovered very well, and she had a good immunity and everything. So here, what I'm trying to say, that was the first time, and followed by, in the same ward, some other care assistant also was affected. So similarly, immediately the human resource and nursing management in our sector, they sent the risky people, people with diabetes, and people above 60, and people who have any other comorbid symptoms. Staff who have any other comorbid symptoms were sent home, and they were asked not to return to work until the further notice. So nearly 3 to 4 months, 20% of staff were asked not to come to work. So there is a huge need or huge lack of staffing. So what happens when the number of staff are reduced on the shift? The workload is increasing, and we needed to rely upon the agency. Agency is external human resource providers. That means some agencies will provide the nurses or the care staff as we need. So they used to provide. But what happens when the agency staff coming in, and they needed some time to get into or settle into the system, and the regular nurse in the system will have a lot of work, lot of other procedures, like she or he has to orient the agency nurse. So every day new agency nurses were coming, so it was really tiresome for our regular nurses. So what happens, naturally it will affect the patient care as well. So the regular patient care was disruptive or interrupted. So, and then changed nature of care. So automatically the nature of the care is affected as well, because the regular care, for example, a patient who has in the elderly ward, we used to give a hygiene care and everything, but because of this work overload and because of this nature of the world thing, so we needed to reduce, or we needed to prioritize only the essential people to have a hygienic care, and we needed to maintain the social distance from them because they are vulnerable as well. So the nature of the care is also changed. And redeploying the staff. So again, from one area to other area, as I said, the people who are in a risk, who are in a very vulnerable age, for example, pregnant mother, or maybe pregnant staff, or people who had surgery, or post hospital people, post hospitalization, after the hospitalization. So they were not allowed to come within, for 2 weeks. Then after 2 weeks, when they came back, they were allocated to non-COVID area or non-isolated area. So, or maybe they were given a light work. So that kind of redeploying, so that again impacted on the system, because the continuity of the care for the patients were not there. So the new nurses and new system and new policies, because of the COVID time policies have been drafted. Then availability of PPE. At the beginning, we had difficulty to get PPE, because I remember on one fine morning, one of the patients had to go to hospital because I think he had a fall. So he had to go by ambulance to the hospital. So I asked one of the care assistants to go, and she refused to go because she said she's afraid of COVID. I said, I'll provide the mask. But still, she was so afraid, so much afraid, because she said she's above 60. She's nearly 60 and she has conditions, comorbid conditions. I said, okay, in that case, she cannot work anywhere. So there was a conflict. So at the end, that evening, we got a lot of personal protective equipments, PPEs, from the health service, the National Health Service. So we got a lot of PPEs, masks. So that is important work for particular the organizational people. So they provide PPEs. So even now, even today, the surplus of PPEs are available here. But I mean, the condition in India, it may be different, because this is Ireland is a developing, one of the developed countries, but whereas in India it is still developing country. So financial things are there. My experience with in India, I mean, like Indian health sector, one of my friends got a COVID symptom. I suggested him to isolate himself at home, or inform the government and isolate himself at home, or maybe go to the public isolative area. But he said his brother insisted that he had to go to private. So private hospital charged nearly 2.5 lakhs for 10 days. It's a package. So meantime, his father also was suspected. So he went into private isolation, private hospital for isolation. So he was charged 3.5 lakhs. So within 10 days, they spent 6 lakhs rupees, and with no big intervention, with no huge interventions. So for my friend, they gave hydroquinone tablets, which was not necessary, because he had no big symptoms or anything. He could have he could have recovered by himself, but because they introduced continuously. He got a stomach pain. So the side effect of hydroquinone was stomach pain. So he started suffering a lot, and he had a constipation for nearly 1 week. So that implication. So it ended up in an argument with the private hospital people. So that won't happen here, because you need evidence-based service. So unless you have a proper evidence, you cannot provide any particular treatment to the patients. So people are cheated. Please don't think that I'm talking politics or anything, but people are cheated in India, and because they are using their innocence, or they are using their ignorance, innocence. Yeah, that's what I can say. Innocence. People's weakness is hospital people's benefit. I'm not blaming all the hospitals, but some hospitals are definitely dripping the money from the patients. Organizational support. So nurses have good organizational support in terms of in here, because in terms of the policies and a lot of other things, support. For example, when we were on night duty, every once in 2 weeks or every week, they started providing the food. So food is not a problem. Everyone will have food. But that indicated that the organization, the hospital, is really supporting us, really looking after the nurses. So that kind of acknowledgement, or that kind of recognition. So we always had a flyer saying thank you nurses, and we got they gave us chocolates, and they gave it as kind of award or certificates, because we were called COVID warriors. So that kind of support really encourages us. We had a lot of difficulties at work, but still the organization support. I could remember the HR manager used to come, and she used to talk to individual nurses personally. And so that shows that the hospital is really supporting them. The management is really looking after them, So that is enough for us. More than money and more than anything, that recognition is needed. So that is a good support for the nurses. And then psychological conflicts between staff. So the staff, when the mental conflict is happening between the staff, because new nurses coming, a nurse who is working in the environment, and he or she may say, I'm not going to work in that place. For example, whereas two nurses, one of the nurses has to go to the isolation area, or maybe the nurse, I mean the patient who is isolated. So the nurse may be refusing. So I cannot go. You have to go. So this will end up. So they have to give up, and they have to come to some conclusion who is going to go. So that are, and not only this conflict, and different other concepts as well. So if somebody is offering, okay, we need to cover the shift tomorrow, so who is going to come? Some people say, okay, I would like to come. Some people say, no, I refuse to come because I cannot work continuously. It's really tiresome. So this is again problem to the system, and the work will not work won't be in progress, so that difficulty was that. And treatment decisions. So okay, for example, CPR. So we all had this is a residential mental health setting. So if something happens, like a collapse, a cardiac collapse, or something is happening to patients, patient is deteriorating suddenly, so our protocol is to provide CPR, like but during the COVID situation, we all got a memo saying CPR should not be done for any of the patients. So that even now, if in any hospitals, one particular ward, one patient has the COVID, so that means ultimately we are not supposed to provide CPR for any of the patients, except people who are mobile, and except people who are not, away from the COVID area. So that was in the situation. So CPR, we did not approach any patients, because once you do CPR, this is going to kill others. You are going to spread infection to many people. So that is one of the treatment decisions. And second one, usually the doctors come to and pronounce the death. So it was so happened that one of the isolation area, one patient died, and I had to walk in as a nurse. I had to walk in. So I was the nurse manager to the hospital. So I walked in, and I walked in with the PPE and everything, and I pronounced the death, and that was I documented everything. So that was the final one. So the treatment decisions is varying because of the COVID situation. So we need to have that kind of quick and that kind of assertive decision makers. The nurse-patient communication. So definitely nurse-patient communication was interrupted because reduced. We had no time, wearing mask and PPE. We had no time to spend. We had no more time to spend with the patients. So it was really tiresome for us. Whereas we never increased the number of staff due to COVID. Instead of increasing the number of staff, we decreased the number of staff, and we suffered really with all these kind of arrangements. So the patients were transferred here in the isolation ward, then from the isolation ward to different ward where the bed was available. So it was really difficult for the patient, and as well as difficult for the nurses. So there was no proper communication. Like usually we do one-to-one session, and we do supportive sessions for the patients, but these all were not happening. Even the daycare services, like people were not taken outside for the walk or anything. So these all were interrupted. So that's what I said, nurse-patient communication was interrupted. COVID-19 testing for staff. So at the beginning, some people who were suspected were tested. And then after 2 weeks, they said, okay, we needed to test everybody because we have to protect all the staff. For example, as I said, until 2 weeks before, we had no symptoms and we were free from COVID. But again, there was a suspected case. And last week I walked into one of the patients. She had a UTI symptoms. So the dipstick was done and it showed nitrate positive. So eventually I called the doctor, and at night the doctor said, okay, she seems to have a UTI and there is no need for isolation because she is prone for UTI. So isolation was taken off. So what happened yesterday, I received a letter saying she proved to be a positive, and now I have to be under monitoring. So I have to undergo COVID test tomorrow. So now, not only me, the people who were in the contract with, I mean, who were in the contact with that particular ward, so everyone had to undergo the COVID testing. So, okay, how was my feeling when I went for COVID testing? So it was not like going for normal blood test or anything. It was like kind of very anxious. Okay, if the test is positive. So immediately after the COVID test, people used to support. Oh, it's okay, no problem, don't worry. And we used to send the chat. What is it? We used to share the feeling, how we were feeling like. The test result came to me after 10 days, because at the beginning it was a bit slow. So after 10 days I got, but some people who got a personal mail saying they were positive, they had to isolate. So they had to lose their 2 weeks of money and salary, and they had to lose their night duty and everything. So this was really, really, even now, tomorrow I had to go for COVID testing. I still have a bit of nervousness. If it is positive, what will happen? So these kind of things are there. Then emotional reactions. So as I said, it is not easy, because some people who had a risk, who have the risk of spreading to family, they were provided a the hotel accommodation by the health services. So she or he has to go straight to the hotel, not to the home. So they had to communicate with the family over the phone. Okay, forget. One of my friends who has to travel to India to meet his family all the time. But now what happened? He could not fly for 6 months. Past 6 months, he could not fly. So nearly the whole 2020, he had to chat. He had to see their family, the young children, only via WhatsApp or video calls. So this is really emotional, really seriously emotional. Individual or peer-to-peer support. Okay, let us talk about next 3 slides. I'm going to talk about 3 levels of support. Then we'll be finishing. Okay, individual or peer-to-peer support. So how can a person support himself or herself? Self-care at work. Definitely, self-care is important, because whatever you do, even at any time, even at college, or even at your any other workplaces, you must look after yourself. People say, I'm working hard, I am not going. So I hear from my colleagues that, oh no, it was a really terrible day, I could not go for my break or anything. That is nonsense. So don't be skipping your break. Don't be doing too much of work. You can manage your time, but you need to take your break. Just 1 to 2. If you are a lunch break, you must take that break. So because that time is needed, you won't be feeling, because you feel that working hard is really good for you. You feel really, encouraged or anything, but that will put you under stress at one stage. So better look after yourself. Self-care is important. Then calming strategies. So when you are so much alert, when you are running continuously for the work, so your body and your mind will be so much stressed. So how to calm yourself? Focus on what's in the mind. Focus at some stage. When you are continuously running or continuously working, you may not be able to concentrate during the medication or during the documentation, or when you are communicating with somebody, you won't be able to concentrate. So try to focus. Take few minutes, few seconds, and try to focus what's in your mind. Are you thinking about your family? Are you thinking about something else? What is stressing you? So try to focus yourself, and then come to the point. Okay, everything, I'm leaving it behind. I'm going to focus on what I'm going to do. And then acknowledge thoughts and feelings. So you need to understand, okay, my mind is thinking about my dad or my family or something. I need to make a call. Okay, give excuse and go talk to them and finish it and come back. Focus on your thoughts again. So acknowledge thoughts and feelings is important. Okay, this is what I'm undergoing. I'm really undergoing the depression, or I'm really undergoing overwhelming. My emotions are overwhelming. So you need to acknowledge it. Yes, I do need help, So then come back into your body. Then again, what to say, focus onto your body, like, okay, I am coming down, I'm not nervous, I'm not what to say, short breathing, I'm not over reacting for anything. They engage in what you are doing. So this is called a kind of mindfulness. So engage again, go and do your work while you are documenting. Document, focus on your document, because I could see when I was doing the documentation audit, I could see a lot of, during the COVID period, a lot of errors. Some people must have mistakenly written the document on some other patient's file. Sometimes the essential information must have been left. So these all happening because they were not focused. It is very hard for them to focus. So that is what I'm saying. Engage in what you are doing. And medication errors. Errors were very common during COVID period. So we had to support them, and we had to tell them, remind them, take your time and keep yourself. And medication time is protected time, so do not engage in any other things, and then meditation and mindfulness. So you all must have heard about mindfulness, or meditation and mindfulness. So meditation is form of kind of, you put yourself in physically quiet and comfortable place and try to focus on something. Mindfulness is similarly the same thing, but you are going to be involving in what you are doing, so being mindful. So this is a big topic, so just to try to look into the topics of mindfulness. Mindfulness is really, really important, especially people like us working in psychiatric environment. But any nurses would need a mindfulness. So try to practice mindfulness. That's really helpful for your personal life and professional life. Ventilation of feelings. So we all have our own feelings. See, I have you need a punching pillows at time. So when you are feeling way to say different kind of emotions, anger or worried or sad or whatever it is, you need to ventilate. So you can ventilate to your friend, or you can ventilate. So sometimes you say gossip. No, it's not about gossiping or rumor, but it is kind of, you are reflecting yourself, or you are opening up your feelings. So I have a friend. So whenever I feel like overwhelmed or anything, I just call him and start speaking. So his role is only to listen to me. He won't be judging, he won't be directing me or anything. He will listen. So same way, I listen to somebody who can ventilate to me. I always offer to my staff. So if you want to talk to me, 2 days ago there was a medication error in the ward. So I had to speak to particular staff. So I had to explain to her. So I know it's really, really emotional time, and you may have anxiety and you may have a lot of stress. So if you want to talk to somebody, you can talk to your friends, or you can talk to me at any time. So you put yourself available to people, and at the same time individually you must be ready to, it is very good to ventilate to somebody. You always must have some good friends. You must go and ventilate to them. Do not bottle up your feelings. That's important. And buddying system is, suppose somebody is coming newly to the system, and it's better to what to say, not like a mentor is a different, but whereas buddying is, you find your own companion partner to do the work. So when I joined here, I had a partner who came from Kerala. So we happened to work together all the time. So we were buddies, like, so we helped each other. So we shared the information each other, like, so that really helps you. So even in your own system, you need a buddying system, so that will support you. Peer support. Peer support is important, like your own colleagues. So as nurses, you must support each other, like the nurses must support each other. I always hear from the nursing, my colleagues, that they work together and they chat easily and everything, but as a manager I could hear that each other complaining to me. So this girl complains about the other girl complains about this girl to me. So that should not be there. You need to support each other. So if whatever happens, the peer support is why do we say peer support is important? So your manager can support, friends can support on all these things, but peer support, so the people in the same group or people in the same area, if they support, then it is more effective than any other support. So they can say, I see, I have undergone the same thing, or I have seen the same similar kind of people. So do not be worried. I know this particular situation. I know your worries, but don't be worried. This can be dealt like this. So this kind of support is essential. And team support. Okay, team support is much more important. And how we can work as a team. So we all nurses try to show our efficiency and everything, but it is important that we must be a team player. It is not like I do everything and she does everything and I can do my best. No, that is not the way at all. Any work must be a teamwork, and especially in nursing, teamwork is important. So nobody is going to assess you whether you are whether you are a good speaker or you are a good therapist or anything, but they are going to assess you whether you are a good team player or not, because ultimately the achievement is not your personal goal. The achievement should be the professional goal, or achievement should be the objective is the main objective should be achieving the common goal. Common goal is patient care, so team support is important, teamwork is important, team support is important. So respect each other. So we should not be blaming. I mean, like, okay, she's, I mean, like some people may feel she is not able to cope with this situation, she's always feeble minded, because I know one of the nurses who always rings me. So I when I go I mean, the opposite shift person, she was so independent, she was managing the ward very well, but whereas this particular staff nurse who was asking me every time, at least in within 12 hours, sometimes 16-20 calls maybe, because shall I do this, can I do this, oh, I don't have the staff and I don't know when I can go for break, I don't know who is going to relieve me. So these kind of questions. So it does not mean that she's incapable. I need to respect her. I need to respect her feelings. I need to respect her experience, expertise. I need to respect her values, So you need to show that kind of attitude rather than putting them down. Do you not know that? Do you not know all these things? How many years you are working here? That kind of bonding, that kind of questioning, that kind of attitude is really, really bad. So you need to respect all your team members and their feelings, and recognize what they need, recognize what they are working. I mean, like, during that COVID period, it was really, really good experience for me, because I had to explain and I had to focus on their positives. I had to thank them all the time. So I know one of the nurses who always did everything, and I really appreciated. Okay, you did everything without asking me, and with what you did was right. The documentation, medication, everything was perfect. So you need to recognize, as nurses, as I said, we all long for that kind of recognition. So that should be happening more spontaneously. That should happen spontaneously. Thank you, and then pointing out their work. Oh, this is really good. So sometimes I went into the ward and I always pointed out, oh, their documentation is clear and that kind of thing. So recognition is important, because we happen to point out only their remarks, only the negative things, but that is not the thing. You need to recognize everything, whatever they do, good things, and then seek out opportunities. So you need to find the opportunity to help them, to help each other, or to communicate to each other, so that kind of opportunities you need to find, and then value each other. For example, so if you if I'm there, so I know I'm a nurse manager, it does not mean that I know everything. The nurse who is in that particular ward knows, and she or he can do anything. So I need to value their presence, value their efficiency, value their work. Then safety of the staff is very much important. Safety of each other. So, for example, I mean, like yellow bin. I mean, you know the bin bags. Yellow bin. We have a yellow bin, green bin, and all these things. So, sorry, yellow bin and black bin. Usually, yellow bin, black bin are there. You know the sharp objects, the needles. So needles must be properly put in a needle box. That means sharp box. So suppose if it is thrown out, or maybe the yellow bag, the contaminated items, if they are thrown into the black bag, it's going to contaminate it. The virus is going to spread to somebody else. So we need to we need to be safe. We need to maintain the safer environment for everybody, especially for our own colleagues, our team people. So we need to do whatever we are doing. It must be with for the safety of the patients and for our colleagues. So that's important. Then staff room. Staff room is very much important. I remember during the COVID period, usually people try to relax in their own ward, a small room or something. But during COVID period, the staff room staff room has played a major role, because anybody can come there and they can pick a Coke or coffee or tea. That 15 minutes is everything for them. So staff room must be very pleasant. Staff room must maintain the good thing. So if you don't have a staff room in your college or in your hospital, it's better you try to enrich the staff room, and that will change the culture. So I had seen the culture is changing from the staff room, you know. So that's important. That's really supporting, and what to say, it's one of the tools, one of the area where you can support each other. Remote meetings and review meetings. So the meetings can happen maybe with the social distancing, or maybe over the conferencing or texting, you know. Have your own group, maybe the ward members or maybe the hospital members. We have an Indian community, so we support each other. If something happens, we support each other. So that's a team support. And managers or leader support. So I can connect myself with this particular topic. So how I supported, how people felt that they supported by me. So approachable and available. So for anything, the nurse managers, I mean, it does not mean it's only myself, and the nurse managers means director, assistant director, clinical nurse managers, even the immediate senior are in charge of the ward, and then health, human resource managers, human resource people. So approachable, they must be available and approachable. So in our health sector, they all were available at any time. So last night, 9 o'clock, and last night I never realized, I mean, I never thought I would get the mail by 9 o'clock. So 9 o'clock in the evening, I got the message that I had to go for a COVID test on Saturday. So which is that means on the other day, 5:45, that means 5:45 in the morning, I was texting, or I was mailing to the human resource manager, and she immediately replied that thank you for the concern. So that kind of availability, that shows that the people are really concerned about us. People are really looking after the staff. So people who put the shield, or who put the screen before them, as if they are great queens and kings, they won't. When people may say like, oh, she is great and he is great in front of them, but otherwise you are not a good leader, you are not going to be a good manager. So put yourself for them in front of them at any time, you know. So what I did was, whenever they called me, I said, okay, I'll come to you. So instead of asking over the phone, I just went directly. Within 2 minutes or 3 minutes, I just walked to them. So they were able to explain everything easily, comfortably, because over the phone they may have a nervousness, but when I present myself to them, they felt that, oh, this man is for us, this man is really helping us, this man is standing by me, you know. So that kind of feeling should be there. So feeling is there, like, you know. Then feedback. Feedback is always important. So you always give a feedback. Okay, this is the right approach. So after everything, the patient is transferred, or patient is moved or some decision is made by the nurse, and I just said, what you did was right. Exactly, you have followed the protocol, and this is really good. So you have saved my time. That kind of appreciation and feedback, constructive feedback. There are two kind of feedback. So constructive feedback and negative feedback. So we don't need to do any negative feedback. Constructive feedback must be there. Then regular communication. I can show you if possible. Anyway, so as I said, every week we get a message from the human resource team. So what are the things happening in the world, in Ireland, in our hospital? How many COVID patients or suspected cases are there, and how we are managing? What are the things? For example, they advise the staff not to share the car, and if we come by car, we need to wear the mask. And what are the other risk factors when we go, and what are the other supporting systems are available? Availability of the hotel for free accommodation. Then they communicate to us, these all the days we provide the free dinner or free meals or something. So these are really good. So it means that we can communicate with them easily as well. And there is transparency in the communication. They do not hide anything. There is a transparency. So everyone will know. So it's not only belonging to the higher person. It is belonging to everybody. Especially in my service, the director, assistant director, and the staff, everyone knows the same information. So it does not mean that only the director knows. So if the director knows, that means all the staff, everyone knows about it. So anyway, then staff well-being as the priority. So that's always important, that staff well-being is important. So first thing is patient care, and if the patient care has to be good, staff well-being is important. So I need to look after my staff, and so that the patient care will be perfect. And counseling and occupational health support, so that should be provided. Because unfortunately, I never hear all these terms in India, how our nurses are supported. But these all must be provided. Maybe it's available in a big institution, big hospitals. Anyway, here in every hospital, even a nursing home, they provide the counseling and occupational health support. So which will help them. They can go and talk to them, and they can get the help from the occupational health. And value of early intervention by seeking help. So the nurses we must encourage. I always encourage nurses to, for example, if somebody is ringing around 3 o'clock in the morning, if somebody is ringing sick, I cannot come in the morning to work, and I immediately ask the question, is it related to COVID, or what kind of symptoms do you have? So do you want any other support from us? Some people would say, yes, I need. One fine example is, one night around 11 o'clock or half 11:30, one of the nurses, one of the care assistant who was on duty rang me. So he said he received a text message from his girlfriend saying she got a COVID positive. So immediately he wanted to because he was minding one of the patients one-to-one care. So I appreciated his honestness, and I asked him, he wants to go home. Yes, he said. So I sent him home immediately, right? So what I'm trying to say is, the earlier he reported, and that was really good. So from then he was isolated for 2 weeks. Then he came back to work. So that really helped him. Suppose if he stayed there, he could have spreaded the virus to the other patient as well. So, and the other colleagues. So what I'm saying is early intervention is important. So we encourage the staff to come and report to us about all this, if they have any earlier problems or early symptoms. And then training is important. We all were asked to do the online training and the regular training for hand washing, PPE putting on and putting down, and then one more COVID, some other policy. So we did regardless of any category, whether it is household, whether it is nurse or whether it is carer. So everyone had to do that kind of training, and we had to submit. So within 2 weeks after, we all had to submit that. We all had to do the training and submitted the certificate, submitted the certificate. So that really helped us because we knew what is COVID now. So at the beginning, we never knew how the COVID works out, how it was going to affect, how it's affecting the respiratory system. Anyway, so active monitoring of staff health. So at the beginning, I think I remember when I came to India last time, I said people are still using the thermometer, the mercury thermometer. But now you see the world has to convert themselves into the upgraded, advanced technology, laser technology. So I mean, every morning as soon as we go to her work, we had to go and get the temperature checked, and it is documented. So not only in our hospital, all over the country. So we walk and our temperature is checked twice a day, twice during the shift. So at the beginning of the shift and middle of the shift, our temperature is checked, and if it is above 37.5, so in Fahrenheit, I think above 100, if it is shown, then immediately we needed to go out of the work. So we were asked to isolate and all these things. So that kind of active monitoring. And not only that, they ask us whether we have symptoms or anything, and that's also monitored. So at the beginning, if we had a stomach upset or if we had some respiratory problems, immediately we were asked to isolate for 2 weeks. They did not want to do any investigations or anything. They just wanted us to go off the work for 2 weeks. So that really helped, Then out of hours support. So we were given the numbers, phone numbers, where to contact. So the staff used to contact me and to say they had a problem and everything. So kind of we put everything together to arrange staffing. Then flexible working schedule. So we provided some of the staff, we provided a flexible working schedule because they had a family and they had they had to take care of their elderly people. So flexible working schedule were arranged, but it's only for few people we had given. Skill mix is important because, as I said, when the agency nurse is coming, some agency nurses may be seniors, they have expertise, so they can go work directly. Some people may not be able to work, so I had to redeploy the staff from one ward to other ward to have a skill mix. Okay, if I allow this particular girl to work in this particular area, it's going to be hard, so I can change the staff and I could ring them, or I can ask the staff to change. Okay, you can go and work on this particular ward, and if you have any difficulty, you can let me know. So that kind of skill mix is important. And especially during COVID situation, isolation, and some people would refuse to go into isolation ward because they wanted to wear PPE. They had to check all the patient's temperature, and they had to be very careful. So some people, they never bothered. They said, it is my work, so I had to go and work. So I just allowed them. So that really helped. So some people, especially people who are single, and they never hesitated to go into the isolation ward. People who are married, who have children, and who have any other comorbid symptoms, or pregnancy, or people who are planning to get pregnancy. So these people had a problem, and they always came out with some kind of opinions or some kind of complaints. Prioritize urgent and non-urgent work. So we, during COVID situation, especially until end of June, March to June, we postponed all the outpatients and all the new admissions. There was no new admissions, there was no outpatients visits, there was no other activities. So only just keep the patients in the ward and look after them. That's all was happening. So in the community sector, in the public sector, the community nurses and everyone was redeployed to the hospital or acute setting. There was no community functioning. There is no community facilities available for the staff. So whenever the patients need or whenever the service users needed something urgent, they could contact the urgent calls, urgent department, and they can make arrangements. Plan for continuous staff support. So as I said, the continuous staff supporting system is available in our services, even in a health sector, public health sector, they are available. So that must be there. I mean, whatever I'm talking, it may be something new to Indian system, but if possible, we need to provide all these things. I do not know how it's going to be constructed, but it should be formulated in that way. Share success and acknowledge everyone's effort. Identify and support the vulnerable staff. Long-term recovery actions. So, as I said, whatever the magazine which we receive, the newsletter which we receive every week, and that will acknowledge that would acknowledge all our success. Okay, now we are free from COVID. There is no COVID positive cases. So we acknowledge, we remember everyone's effort, especially the nurses who are working there. So that kind of thing, that really appreciated, So whereas, the system where the nurses are appreciated or acknowledged will, exist and will, get established very well. Where the system is not appreciating the nurses and pricing all other multidisciplinary team members, the system will not last long. Definitely there will be a problem. The system will not progress in future. So we must always remember how the nurses are looked after, because the base of the health system is nurses. The base of the health system contain the nurses. So the base must be well supported and must be looked after very well. Until 2020, if the nursing system is not well established in India, but now the political people and even the organization people must realize that nurses must be looked after properly. Identify and support the vulnerable staff. As I said, vulnerable staff does not mean only physically vulnerable. Some people are mentally vulnerable. So people with the depression, stress. So I needed to speak to people facing their looking at their eyes, and I had to face, I had to talk to them. And I remember sometimes people used to come to my office and they were burning out, because I could see during the isolation period, during their COVID time, one of the nurses came to me and she was just expressing her feelings for an hour. And it was not about anybody else. It was not about. So she was just explaining how she was feeling terribly in the PPE and how she was feeling very fatigued, continuously running for 12 hours. So that we need to, suppose if I did not I did not allow myself to talk to her, she may be building up her stress and she might go for suicide or anything else, So we need to find out that kind of people and support them. Supporting, always we say support. So that's important word, support. So we should know how to support each other. How the word support meaning different, because in Indian context it is definitely different. I'll talk about that support only for more than an hour. I'm not going to expand or extend about it now. Long-term recovery actions. What are the long-term recovery actions? There are systems which you can ask the nurses to seek for the help. So long-term, the recovery is not going to be short-term; it's going to be long-term. So we need to provide the support for the nurses throughout their recovery. Anyway, so she's one of the nurses, and she's talking in a parliament. She complained that hospital staff were catapulted into the pandemic, because I just wanted to quote the word catapulted. A young nurse who contracted Siobhan Murphy, her name is Siobhan Murphy, young nurse who contracted COVID-19 said that hospital staff were catapulted into the pandemic. So I would say it's, of course, she's mentioned as a hospital staff because mainly nurses and carers. That's why she said hospital staff instead of saying nurses. But I would say nurses are catapulted into the pandemic. I don't know how many people are agreeing it or not, but when I read the newspaper from India, I definitely feel that nurses are catapulted into the pandemic. And I do not know how many nurses have suffered or have lost their life in India. There is no proper statistic, or there is no proper data released about healthcare workers suffering with COVID-19. Okay, to conclude, I just want to conclude with this 2020. We all know, because in 2019, we all were planning to host a lot of conferences. We never heard the word called webinar then. So we all thought of hosting a lot of conferences in 2020 to talk about nurses and everything. But I always say, more than speaking, the actions do. So now, more than nurses speak about our work, speak about our profession, it's a time to prove to the world that we are doing something good. So act and prove. So I know it's very hard time, but I would like to say thank you for everyone. Thank you for whatever you are doing. So no matter where you are working, but whatever you are doing for the humanity, for the people, is really appreciated. And I believe that we all will have good times soon. We all will be away from COVID soon. Thank you. Hello? Hello?
We can hear you.
Yeah, can you hear me?
Yes, we can hear you.
Okay. 1 minute, madam. 1 minute. I thought I was speaking to the air,
No. We are hearing. It's very audible.
Okay. I think that's all. I finished.
Can you please tell me, in Indian setup, specifically what we have to bring a change in the Indian setup? You mean to say only support is not there, emotional support is not given to the nurses, or acknowledgement in what way the nursing leaders has to change in the Indian scenario, please?
1 minute. Let me. Yeah. So who is asking this one? May I know who is talking? Okay. Okay. So in Indian setting, see, this is what I'm saying. I cannot fully see what's happening in India. And I believe the people who are attending this conference also do not know what's really happening in India, in Indian nursing system. So if at all, if somebody who can give me proper idea what is happening in Indian nursing system or clinical nursing system. We all know what's happening in academic area. We all are doing webinars. We are trying to communicate with the students. We are trying to keep the students engaged. But clinical nursing, people who are working in ICU, people who are working in emergency department, so they are more vulnerable people. But what kind of support the government is providing to the people who are working in government? Are they wearing only one PPE the whole for 12-hour shift? And are they wearing, are they provided any remuneration? Are they provided any, I do not know about all these things. So if you have, if somebody can brief about it, then I can say, okay, these are all the area we can improve. But apart from that, we as nurses, I mean, this is not the time to argue or protest to government or private organizations, but at this time, we need to support each other. If people are working in clinical area, support your colleague. People who are working in the academic area, just to try to support your colleagues or fellow people in clinical area, because they really need support. Or you can open up your supporting system, like you can ask the clinical nurses to come and talk to you, you know.
Thank you. Thank you.
Okay. Yes. Did I finish in right time, or did I?
Sir, it's okay, sir. Thank you, sir.
Okay.
Thank you, sir. Thank you very much for your wonderful
No
presentation. So,
Okay.
any other questions? Any other questions?
Maybe in
Thank you,
chat
sir.
box.
All right. Is there anything else you
Maybe
want to say?
maybe questions. Maybe in chat box. We could not see the questions in chat box.
Okay, sir. The question is, in
Yeah.
Indian setup, particularly what we need to implement more specifically in this crisis situation?
Yeah. I mean, as I said, in a wider sense, it is very difficult to. I mean, like in a wider sense, you must have learned a lot of things. I mean, from the month of March until now, you must have. The COVID has taught us a lot of things. For example, we have incorporated whatever we have learned since March in Ireland. So in Indian setting also, you must point out what are the things COVID has taught you, or what are the things you have learned from COVID experience. So from there, we can we can change the policy. So as I said, I mean, it is really hard. It is really hard in Indian situation to, what can I say, comment anything now, because I cannot comment sitting here and without no data and without any information. No, I cannot comment. So it will be politically wrong. Do you understand what I mean?
Yes, sir.
Yes.
Okay.
Yes, sir.
Okay.
Okay, sir. Thank you, sir.
All right. Okay. That's fine.
Thank you, sir. Now we have come to the end of the session. I hope this webinar was very useful and informative one on the topic. Thank you all for joining with us. Have a nice rest of your day.